We're going to talk about SOAP notes. Before I get to the SOAP, I'm just going to let you know what else I put on the note, each note. So I always have the patient's name, date of birth, the date and time of the session. So the date of the session, and then I put the start time and the end time of each session. Put the session type. Usually with private practice, it's most of the time is individual, but sometimes it can be group. So individual or group. And then also I put, was it a regularly scheduled session? So it's like a check marks or basically a list. And then you click, you check the little box. So regular session, makeup session, cancellation. We come to the SOAP. So S, of course, is subjective data. So in this section, I might put something the patient states to me. So patient states, patient reports. I might also put what the parent states, what parent and I discussed. This is obviously relevant to the treatment, to the patient's condition, goals. I write, who was present during the session. Sometimes even if like little brother was there or little sister, I might even add that into the subjective part. Another thing that I might write in there, especially if I have a kiddo that is not verbally communicating or using a device, an observation of, if patient greeted SLP or responded to SLP's greeting with hand wave, whatever it might be, just an example. So it's just an observation. A little grid that just talks about, you can check off motivation and attention to tasks. Then we come to the objective. So objective is objective data as it relates to the goals that we are working on. Could be, patient did such and such with certain amount of queuing, whatever that might be, in 50% of trials or with 50% accuracy. Sometimes it's 4 out of 5 trials, whatever it is, it has to be measurable and objective data that I put in the objective section. I also add some, like, specifically, if the kiddo, they say something for the very first time, I might also just write that in using clinical verbiage. So it shows that it's not just anyone that necessarily that can do the treatment. Insurance wants to see, especially, like, why am I involved? Why is the speech pathologist involved? Why is the therapist involved? What are you doing clinically that someone just who's not trained in what you do, why can't they do it? So by using that clinical wording in your documentation, that shows why you as a therapist need to be there versus anyone else. Case for assessment, and you can talk about why I usually put if they're making progress on their goals, why continued treatment is needed, which also again shows why a speech pathologist needs to come and continue treatment. That just tells the insurance company for sure why your sessions are medically necessary and that they require a trained or licensed clinician. And then plan, you just write your plan. So I specifically write, continue with such and such number of sessions per week, per month, whatever, and for how many weeks sometimes. Also write down skills that we might address in the next session or the next several sessions. It's basically SOAP Note 101 over here. If you guys have any other suggestions as to what should be put, if I missed anything, that would be awesome, because I'm always learning.